Hello, everyone. Welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade. I'm a naturopathic doctor, and I am joined today by Mandy Meehan. Mandy is a nutritionist. She has a whole bunch of other letters behind her name, too, which I'll leave that to her to explain when she's introducing herself. And I'm really excited to chat with her today, in part because she is a fellow clinician as a nutritionist. And she also has her own healing journey story that she's willing to chat with us about today. Up to this point, all the other podcast episodes have been largely, clinician to clinician only, just talking about patients and this and that. But I thought it would be really valuable to listeners to just hear from someone who's, been through the trenches themselves. And as we were chatting about just a minute ago, not Mandy's not necessarily 100% through the trenches, but has made a lot of headway. And I really appreciate you taking the time to chat with me today, Mandy. So thank you.
Absolutely. Thank you so much for having me. And I'm really honored to get to share my story and bring hope for healing while I'm in the midst of the trenches myself. And very, very confident about getting to find my way out there. But like you said, it's the trenches are the trenches. And it is, I'm grateful to get to have this experience to better help clients now and in the future.
Yeah, that's great. Well, if you don't mind just taking some time just to tell folks who you are and just kind of giving us a bit of a background about who you are, the clinician, but then also if you could give us a bit of background about your health journey as well, that would be wonderful, please.
For sure. So yes, my name's Mandy. I'm a functional nutritional therapy practitioner and also a certified dietary supplement professional and certified Lyme specialist. Like you said, those are like the letters behind my name, but really I do right now specialize in working with people with complex chronic illness. And the reason that's the case is because of my own complex health journey, of course. Really to give kind of the big picture of what I'm dealing with. I've got the chronic fatigue syndrome. That was the official diagnosis from the Mayo Clinic. And now I know that I know the root causes that's going into that. It's, multiple systemic infections, Lyme disease, and numerous co-infections. And I'm sure we can probably get into a little bit of that and all of the different bugs that could be at play, mold toxicity, heavy metals, environmental chemicals, and pesticides and herbicides. Really all of those things I know now go into contributing to the cell danger response, the things that's keeping me from being able to exert and exercise and live my life with full energy. So it's been a very long process of finding those answers. It really took a year before I even started really looking for answers, because in the beginning I just thought I had mono and that it would just eventually go away. That's what I was told. It just can take time sometime, but it took a lot more time than what we were expecting, for sure. So it's been a long process, but I'm very grateful now that really there's been so much purpose that's come out of the pain and the confusion and, being forced to leave my job as a young, like a 20-year-old newly married. I got sick 2 weeks before my wedding. That's when my health crashed. I just never would have thought that this would be my career path now and my passion, but I'm so passionate and excited about helping people skip all of the steps I had to take of trying so many things and it definitely not working and not actually knowing how do I find the root cause. And then once I find the root cause, how do I actually find strategies to help me get out of that? So, so much I can go into, but I'll let you decide where to go from there.
That sounds like a plan. Yeah, thanks for the overview. And of course, only share what you're comfortable sharing, Mandy. But as you said, on social media, you've been very, as you said prior to this recording, you've been very open about like a lot of the things that you went through, especially in the earlier years of
Yes.
your diagnosis and symptoms and whatnot. But yeah, any topic you don't want to talk about, obviously, totally fine. Just to give our listeners / viewers some context, like in terms of the kind of main symptoms that you were dealing with out of the gate, like obviously fatigue, if you had the chronic fatigue / myalgic encephalomyelitis label, what were some other sort of notable mention symptoms, if just to give listeners some context, if you don't mind sharing?
For sure. Yeah. So to set the stage a little bit of what happened when my health crashed. And at the time I wasn't putting all these puzzle pieces together, but now I can kind of show the context. So it was a very stressful time in my life. Obviously, I'm about to get married. I moved from one town to another. So I moved jobs, moved homes. I'm planning a wedding. I started hormonal birth control, thinking that was my best option since I was about to get married. I was thinking about those things. And it was actually days after starting hormonal birth control that I felt very, very tired and just not myself. And I thought, is this a side effect from the pill? I hear about side effects. The OBGYN said that there's like very minimal side effects from this pill. And I thought it was just that, and it would hopefully fade away. That fatigue started getting much worse. And then it became much more flu-like. I had pretty severe swollen glands, and just, I remember being at work and thinking about just walking across the room and just being paralyzed and thinking I can't do this. So thankfully I actually went and got diagnosed with mono. And like I said, that's just all that we thought was there at the time. Now I really strongly believe that the building I was working in was moldy. It leaked constantly when I was there. There were like buckets everywhere to catch the leaks.
Oh, no.
So
Yeah,
it was
not good.
Yeah, not a great building for sure. So I really believe that, the stress, the emotional stress, the stress of moving, hormonal birth control, as we know, it can really slow down methylation. So, you're not detoxifying as well. It depletes a lot of vitamins. It can, kind of create stress on the gut and cause intestinal permeability. It can be very, very stressful on the body. And then the mold exposure, I believe that just all of that at once caused the Epstein-Barr virus to reactivate. But I really wonder if there were a lot of other infections at that time that kind of all flared up at the same time, because I know now there's a lot of infections at play. So you asked the primary symptoms. The fatigue, like you said, that really is the number one thing. Brain fog definitely has been a prominent thing. Off and on, there's a lot of moments where I'm pretty cognitively strong, and then in the early days especially, I remember like not being able to get through a page of a book because it was so debilitating. Suddenly my digestion went from like chronically constipated, a little bit bloated, which is not great, but like really manageable to me, to I can't tolerate anything but just a few foods. I would have horrible reactions to anything containing fat. I started having anxiety for the first time in my life, depression for the first time in my life. Then chronic pain started, just really over time, just more and more things kind of got added to the list. Or over more time, very severe lymphatic congestion, like in my armpits and under my knees, like there'd be ping pongs in my lymph nodes. At points, I had very severe neurological symptoms. At one point, we ended up finding out we were in mold again, and I had to use a cane because my balance was so kind of like I was on like a dock or a moving ship where the floor was just moving, and I would be walking normally and feeling like I'm just gonna fall over at any point in time. It's really amazing how toxic mold can be. Of course, that completely went away as soon as I got out of that moldy environment.
That's great.
But yeah, so there's been a lot of symptoms, but primary has certainly been the fatigue, pain, digestive, hormonally. There's been a lot. Every system really was very stressed. I was postmenopausal hormonal levels at one point. And one of my favorite parts of my story, and to give hope to people, is that I have a son, my 2-year-old. I was able to have a beautiful pregnancy and home birth while very debilitated and fatigued and not able to exercise, hardly, go on very long walks. So the body's pretty amazing that it can get through a lot of those things, even in cell danger response, even in that chronic illness.
Yeah, it is amazing what the body's capable of. And I've had several patients over the years, women in their maybe 20s, early 30s, and they've been suffering for a long time, and then they're pregnant, and then just have this very healthy pregnancy, and
Right.
they're still, it's not easy, but like they have
Right.
perfectly beautiful healthy babies, and then yeah, it's just like, wow, like the body just really knows when to rally when it's like really really extra important, it seems.
It does.
So it's a beautiful thing. um Bunch of questions for you based on what you just said, but one thing I just want to maybe touch on first. You mentioned the cell danger response a couple of times. I think it's a
Right.
really, really important topic for clinicians to know about. I'm sure that many of my listeners are aware of the cell danger response, but would
Right.
you mind just kind of giving like a brief, like, layperson summary of, what is the cell danger response?
Right. Yeah, it's a great question, and I really do like the concept. And I usually when I do explain it, it is very broad and layperson because it is like it can be a very very complex subject for
Mhm.
sure that I'm constantly wanting to understand better. I believe I saw you've got. I don't know if it's your practice has like a training on it. I was looking on your website. I'm like, oh, I need to do some more continuing education through y'all.
Right. Yeah, I have a course on mitochondrial dysfunction, and I definitely talk about the cell danger
For
response in
sure.
there for sure. Yep.
Right. That makes sense. So the way I describe it to my clients typically is it's kind of like when you get the flu, your body is focused on fighting that flu. You don't have any energy. You're feeling lethargic. You're not feeling great because your body's sending all of his energy to fight that bug. And then in complex chronic illness, because of toxicity, infections, and I think trauma can be very involved too. It can cause our cells to get caught in almost like this stuck the stuck flu. It's not actually the flu, but you're stuck in that sickness. You're stuck in that ability for your body to be able to just make energy because it is it's been so focused on trying to fight the infections and deal with the toxicity that it's just really not able to any longer. So in my belief, it's lowering toxicity, building up the body, and then helping your body fight the infections is what can help your body get out of that cell danger response. I feel like you probably could have add on. Yeah, I feel like you could add on some good notes to that. But that's kind of the basics of how I explain it.
Okay. No, that's great. And maybe just one little add-on note, just to the icing on the cake there is a
Right.
good cake. But just where if your cells are stuck in this lockdown mode, then they're just kind of so hyper focused on dealing with the toxins or the
Right.
infectious insult or whatnot that they just kind of forget about all the day-to-day stuff. Like, oh yeah, you
Yes.
need energy to, like, go to your job and take care of your
Right.
kids and exercise and all these things. And the cells are just in this lockdown mode, as I think you said, and just
Right.
aren't able to function properly. So hence,
Right.
chronic fatigue syndrome and brain fog and pain and all the crazy things that can ensue from that. So
Right.
it's really, really not a pretty picture, unfortunately.
For sure. Right.
So, in terms of your health journey, where you mentioned like one of your goals working with folks. I know prior to us starting the recording, you mentioned you do work with some folks one-on-one.
Right.
You also do some group coaching and whatnot as well. So when and you mentioned that one of your goals, I'm paraphrasing here a little bit, but one of your goals is to try to save folks going down the paths that didn't help you, and let's
Yes.
tap into the paths that did help you the most. So
Right.
maybe starting with the glass half empty, I guess. Would you mind
What I
telling us
tried.
about what are the things that didn't work well for you, if you don't mind
For
elaborating
sure.
on that?
Absolutely. Well, the very first thing that I did wrong is that I tried to fix myself by myself. And I've always had a little bit more of a holistic mindset. I didn't know anything. I knew that I value nutrition. It was really like a year or so before I got sick. I actually wasn't having my period regularly, or I was had amenorrhea. My period was absent for probably a couple years. And I thought like, oh, I should probably have my period. That sounds kind of like a healthy thing. And I was Googling, what can I do to help? I read that gluten could be a trigger of hormonal issues. And so I decided to do a trial and cut it out. And 2 days into being gluten-free, my period like came back that
Wow,
quickly.
that's wild.
So there were things like that in my life before where I realized diet's pretty important, lifestyle's pretty important. But like I said, I still had a lot to learn. So from the beginning, I thought I should probably be supporting my body as best as I can. They say there's nothing you can do for mono other than hydrating and resting.
Mm,
It's interesting that even the medical system doesn't even recommend antivirals. That's odd to me.
mhm.
For mono, I mean, I guess it's just probably not very effective. But so the very first thing I did, actually, I read The Bulletproof Diet by Dave
Uh-huh.
Asprey. And I remember reading about his chronic fatigue syndrome, and he was talking about mold illness, and it sounded so much like me. And I was like, oh, okay, this diet is going to be the thing that really helps me. So from the beginning, I really focused on nutrition. I read books on leaky gut, and so I was just trying to adjust my diet and kind of throw in random supplements I was learning about to see if it helped. And unfortunately, because I didn't have someone to support me, I think my gallbladder health was pretty, had some a lot of stagnation there, which didn't work well with the very high fat diet that led to the essentially fat intolerance that I had for probably like, oh man, it was 6 months to a year where I couldn't even add like a sprinkle of olive oil onto my food. It was
Wow.
pretty intense. So I was just kind of scrambling for a while with things like that. Then a year into it, we figured, okay, we need to make sure that I don't have cancer, I'm not dying, we don't know what's going on and why I'm so sick, and just seemingly getting worse. So that's where I was diagnosed at the Mayo Clinic with chronic fatigue syndrome and fibromyalgia. I was very hesitant to go because I honestly didn't really believe that they would give me very real answers or actually like a protocol to get better. But I had family who was really encouraging it and supportive. So I figured, like, let's just see what we can learn. And I ended up not even going through all of my appointments because I just didn't really think it would be that helpful. Again, that whole time I'm just reading books on dirty genes from Dr. Ben Lynch. I am sharing my story on YouTube at this point and realizing I'm really into nutrition and really like love learning about epigenetics and all these things. And I'm starting to kind of share, like, I do know what I'm talking about. And, I'm learning a lot for sure.
Mhm.
So I'm just trying it and failing, and nothing's really making that much of a difference. There were small things that improved my blood sugar, improved quite a bit. I realized, it's not normal to be incredibly shaky, like you're going to pass out in between meals. My
Mhm.
C-reactive protein, my inflammation levels improved. So those were good things that changed. Then I discovered DNRS, or dynamic neural retraining system. It's a like self-directed neuroplasticity course to help rewire the limbic system to get you out of fight or flight so that your body can be in a better place to heal in that rest and digest state where the brain can actually kind of similar to cell danger response. You don't want to be living like you're running from a bear. You want your brain to be able to actually take care of normal functions because your body's not thinking about digestion when you're running from a bear. It's just thinking about getting away from the stress. So that was the first thing I did that actually really made a big difference in my symptoms. I actually noticed a very real shift at that point. I did it very consistently for at least 6 months. It's a very intensive process of kind of like a form of meditation that you do for at least an hour a day, except you're specifically visualizing yourself healthy, reminding your body of what that's like to be energetic and to feel good in all of those different ways. Then it was after that point, I thought that, I thought that neuroacupuncture was going to heal me, and ended up being a very
Could I
kind
ask
of,
you a quick interjecting question? Sorry to interrupt, Mandy.
please
You're
do.
on a great roll.
So many
I'd like to
things.
ask you one question about the DNRS because I've had
Yes.
a number of patients who I recommended DNRS or the Gupta program for, and
Right.
just one of the things that some of my patients have run into, justifiably, is that it is, as you said, like the DNRS in Gupta is pretty darn similar to DNRS from by my estimate. So this question applies, I think, to both programs. It can be like kind of intensive. And did you find that given the energy limitations that you had, like was it challenging for you to do the hour of work every day? And if so, like were there any tips or strategies to kind of get through that? As I've had some patients who are like, I can only do like 15 minutes and that's it. And of course, we just meet patients where they're at. You can only do what you
Right.
can do. But any advice or feedback on that?
Right, that's a great question. I did recommend DNRS very strongly for a while, and at this point now, I believe that I don't love that for me at least, my approach and how I interpreted the training, that it was just so cognitively focused, and it was missing this somatic, like the brain body connect, like where I was really connected to my body and kind of working on that, like regulation and trauma release from a body point of view. So that's one thing that I would say that I often direct people to, maybe a GNRS type approach plus some somatic experiencing as a practice that kind of helps connect your brain and your body. It's interesting if someone is really struggling to get through it. I mean, for the most part, I would think most people can get through it, breaking up the practice into segments, whether that's 10 minutes 6 times a day or 15 minutes 4 times a day.
Right.
I would definitely break it up. I think I'd probably do 20 minutes 3 times a day. And I mean, if it's my client and they're really struggling to get through it, I may have them take a more gentle approach, to be honest, more of the somatic experiencing based therapy. But if cognitively they are able to get through it without feeling way worse, it really does just take discipline and committing to do it. Even, I mean, I remember going into closets on Christmas Day, at weddings, as I'm getting ready to be a bridesmaid, hiding in rooms, like I got to go do my DNRS. So you just kind of have to make it work.
That's commitment right there. That's amazing. Just another side question. With the somatic experiencing, I've only ever heard of that being done with kind of one-on-one with a clinician. Are there
Right.
like online or self-directed somatic experiencing programs that you're aware of?
For sure.
Oh, really?
A good friend of mine, actually, the week I found DNRS, I found her YouTube and we became friends. And now she has this amazing business and platform. Her name's Sarah Jackson. She has a program where she has classes that are online that you can pay per class that are really, really excellent at helping you learn some of those techniques. And then she has a program called Restore also, where you have access to a library of different kind of exercises you can do.
Okay.
I also really love Irene Lyon. Her last name is Lyon. She has a 21-day nervous system reset, I believe it's called. That's really kind of an introduction to her work. I did do that course, and that course. I tell people now, I wish I would have done that before DNRS, because it really teaches, in my opinion, like the foundations of nervous system regulation, including the somatic aspect. And then she has a bigger course too that I know that people really appreciate. But those are my 2 favorite resources.
Yeah, no, that's great. Thank you. Are they just look those up on just their websites, or are they on Instagram or YouTube, or just?
Yes, both. I think websites and Instagram would probably be easy places to find them.
Great. For listeners, I'll post the links to their websites anyways in the show notes. So stay tuned for those. But yeah, thank you for sharing that. That's great. Yes, I find with I made up my own sort of a truncated version of amygdala retraining for patients. Like I made an hour and a half long video because just so many patients are like, oh, this is really overwhelming. It's a lot. And that's been a nice stepping stone. But yeah, maybe the somatic experiencing to sort of, test the waters first a little bit. That's a great tip. I'll look into both of those. I know I had interrupted you. You were onto neuroacupuncture was the next step on the journey. So if you don't mind picking up where you left off there, please.
For sure. Yes, between my keto bulletproof phase, being, the ketones are so great for the brain, and then limbic system, I need to heal my brain. And I do think myalgic encephalomyelitis, that you can break down the word to inflammation of the brain. That's one of the words for chronic fatigue syndrome. And so that was kind of my strategy, is I just have to, if I heal my brain, I heal everything else, which isn't entirely wrong. So I thought this neuroacupuncturist was going to fix all my problems. And it was interesting. I often tell this part of the story because my story kind of blew up a little bit on Instagram at this point. This is really where my following started to grow. And a lot of people would be really excited about that. And I was very excited and thankful, but it created a lot of anxiety and pressure that this has to work. And that if it didn't work, I would feel like I was failing or I was letting people down. And I mean, I had never had so many texts and DMs in my life, just because like kind of the story of like, pray for Mandy going to New Mexico to see this amazing. And he really is an amazing scalp acupuncturist. I saw people getting up from their wheelchairs for the first time in
Wow.
years and things
Wow.
like that. But I mean, I left, I had moments of feeling better and then left feeling really worse than ever by the end of the week. And so it became kind of this traumatic experience where I had to get off social media and YouTube and everything entirely for a month. I'm like, I'm just going to take a fast or a detox from this and really kind of focus in. I'm a Jesus follower. Like I want, ask God, like what's next for me? Like what's going to help me get better? What am I supposed to do? So it was very quickly during that time off social media. That's when I realized I want to be a practitioner, a nutritionist or health coach or whatever, that I couldn't not help people who have been through what I've been through. Knowing what I know now, there's no way I couldn't share.
Mm-hmm.
So that's when I found that program, the original program that I did. And it's kind of cool to see how, so all of that led to my career now. And also I decided I need to actually really get help now. Like really I could find a good practitioner. And that's when I finally, I think 3 years into my illness, found like a functional medicine practitioner.
Mm-hmm. That's quite the
So
wait.
it's
Yeah.
so crazy because I loved following Dr. Mark Hyman and Chris Kresser and Dr. Ben Lynch. And I loved learning from these people. And I don't know why I just didn't really, I mean, I think I was very paralyzed, especially because I was constantly getting unsolicited advice of check for Lyme, look into
Mm-hmm.
mold. And I'm like, I just had mono and I'm still sick. I don't know what mold or Lyme has to do with anything.
Mm-hmm.
It was just overwhelming. So I just kind of held off, but
Mm-hmm. Fair enough. Yeah, and that's I as a clinician, I appreciate that insight because, like, I mean,
right,
I had my own health challenges in the past, but not
right,
compared to what you were experiencing. I'm thankful to say for my own sake, and just yeah, kind of getting a bit of insight into the mindset of like, yeah, is it
right,
just really overwhelming? Like, you listen to, someone might be following someone like me or whoever, like on
right.
Instagram. It's like, oh, like mold and Lyme and co-infections and viruses and mast cells and SIBO and like just there's just so many acronyms and so many things and like maybe it's just easier to I don't know this. I'll ask you this question if you don't mind, just speaking as a as a non-clinician, let's say, like is there an element of like like I just there's so much like I kind of want to put my head in the sand, or there's so much like just thinking about it's too stressful, like can you give some insight into the mindset if you don't mind?
Right. Yeah, I think there were a lot of things at play. It's interesting because I was always very committed. I mean, as we talked about with DNRS,
Mm-hmm.
I was very, very disciplined and was constantly trying things to help. I see people now where I struggle with, I don't understand why you're not even trying anything to get better, why it takes
Mm-hmm.
you long to even take any kind of action. So I was constantly taking action. But yeah, part of it was, I mean, I was also just afraid to spend money. Part of it was
Sure.
I didn't really trust anyone.
Mm-hmm.
And uh, I didn't really know who I could trust or what was out there, how to find people that I actually believed that could help. And it's tough because I constantly was having names kind of thrown at me of people to see. And I think I was partially waiting for something to really feel right.
Mm-hmm.
It's interesting because I wouldn't do it differently now because of course it's, it's part of my story, but I would have other people do it differently for sure.
Mm-hmm. Well, I appreciate you bringing up the money factor too, because as we're
Right.
talking, I'm thinking like, oh man, like I know I've had folks, DM me or post comments where like, oh, like, I'd really love to do this or that, but like I don't have the money or I have to save up for 6 months. Like, oh my gosh, like just it's so sad that there's a financial barrier to folks getting well, but that's the reality of it. And
Right.
that's really, really unfortunate. But yeah, you certainly when you want to make sure you're making the right choice, because you can't just, well, I mean, there are some folks out there, I suppose, who have the wherewithal that they can doctor shop around, but not many
Right,
people have that luxury. So you
for
want to make the
sure.
right decision. Um, Mandy, maybe we can switch gears just a little bit, because I know we've
Right,
talked about some of the things. Well, I kind of talked about a bit of a hodgepodge of things that have helped you, but then also some things that didn't. Do you mind, because I would like to pick your brain kind of more clinician to
right.
clinician a little bit too. Would you be able to just talk about some of the things that you found to be particularly helpful, or if there were any other pitfalls, if you want to sneak those in quickly, just to,
For
I don't know,
sure.
share that. I'd love to hear a bit more about that, but also what's been helpful for you.
Right. Yeah, I will kind of merge the two together, because
Right.
once I finally started working with a functional medicine practitioner, I finally tested to see that for mold toxicity and metals and glyphosate, and saw that I did have a very high toxic burden. We tested for Lyme early on, and it was a negative test, and we didn't really know what to do with that. We kind of just left that on the wayside. It wasn't actually until last year that I finally officially on paper found Lyme, Bartonella, Babesia, Toxoplasma, Anaplasma, Mycoplasma.
Wow.
It was really last year. And I kind of assumed for a while, yeah, mold or Lyme is probably a part of the picture, but last year was when everything really, really came together. But it's interesting, even when I started working in functional medicine, we did just take you have a high Epstein-Barr virus antibodies, and we were taking much like just kind of detoxification and antiviral approach, and that did not work very well at all. And I have all kinds of opinions on why that's not the right strategy. So yeah, as a clinician,
Could you share those opinions? Because I'd like to hear them, and I'm sure the listeners would too, if you don't mind.
for sure. And I think I kind of can share my perspective on how I do approach things to kind of address the viral aspect briefly. As many people know, Epstein-Barr virus or HHV6 virus or any other herpes virus, or they're considered opportunistic infections. They like to flare up at the opportune moment when there's something else there. And my question always is, what is it that's causing Epstein-Barr virus to be flared? What's causing the immune system to not be strong enough to be able to keep these things at bay? And so when we're just especially in the very intense chronic fatigue person, patient, client, whatever you want to call it, when there is such exercise intolerance, I do believe that there's usually a larger list of infections that need to be addressed. So just targeting one virus or one group of viruses is really missing the big picture and really missing the
Mhm.
true root cause.
Mhm.
And I can kind of get into that. I think I said it earlier. I always talk about how, in my belief, the three main root causes of chronic illness or chronic complex illness is toxicity, trauma/stress, and infections. I know some people would say, oh, what about deficiencies? And to me, I mean, if there's to me that's not like that shouldn't be a chronic illness caused by deficiency. If it is an illness, it should be easily corrected by just providing that nutrient. You've got scurvy, like give vitamin C. For so many people, I talked about this in my story, and I know you've probably experienced this with patients as well. You see these people coming in who are eating like the most pristine diet, the most nutrient dense, and they're as sick as ever. So really, it's not the lack of nutrients that is the cause. Obviously, we want to be working on actually absorbing those nutrients and utilizing them well. But I believe that the toxicity, the infections, and the trauma that's stored in the body causes the immune system to really just fall out of balance and keep you in that cell danger response. When I say toxicity, I'm thinking about things like mold, heavy metals, glyphosate, other pesticides and herbicides. When I say infections, I'm thinking about everything from parasitic infections to even like a candida overgrowth. And of course, the Lyme disease, the many co-infections that come along often with Lyme, like I mentioned, Bartonella, Babesia, Mycoplasma, and then those viruses, CMV, Epstein-Barr virus, HHV6, HHV7, there's many. I had a thought there. that I lost for a moment. But I'll let you just respond then.
Okay, sure. Well, you were saying about like with the three, main root
Yes,
causes. So you mentioned like the litany of different infectious microbes. You mentioned the litany of different
right.
toxins. And then were you going to say more about the trauma/stress component, or does that kind of speak for itself?
I think it does to an extent. I do think that trauma is often um, a lot of people, for me personally, I can say in my own experience, I didn't think I had really experienced trauma because there wasn't like an obvious obvious car accident or loss or things that you may typically think about. But I think trauma is a result of, let me say it this way. If you can think about like two people who've been in a car accident and one person is totally fine afterwards and the other person um, doesn't want to step into a car again or has a lot of fear of driving now or being in vehicles. And the reason they respond differently is because of the health of their nervous system. And I believe the health of your nervous system, you can have dysregulation due to it could be early childhood trauma, or it could be I think even toxicity can be a trauma to the nervous system that can cause some of that dysregulation. Really, to me, it all really works together. Getting sick very quickly is traumatic. For me, I was 20 when I got sick and I got married, and not knowing if I was dying and why I was, forced to I wasn't able to work anymore. Obviously, I got sick before that happened, but there's kind of a cascade of trauma that can occur there that can kind of further continue illness. So, I mean, there's so much I could say when it comes to trauma. Earlier, I mentioned the stress of, wedding planning and all that plays into it. But I think there's so many factors that contribute to that full body dysregulation.
I totally agree. Um, so, could you speak a little bit more to some of the specific therapies that were the most helpful, or treatment approaches that were the most helpful for you?
For
I'm
sure.
assuming it has something to do with addressing the big three, and you'd already had the DNRS and the somatic experiencing under
Right.
your belt. So, I'm assuming other helpful things related to toxins and/or infection.
For sure. Yeah, it's interesting. I did do a lot for detoxification years ago that I don't believe was the most effective strategy. And partially it was because drainage wasn't fully addressed. I'm sure many people listening are familiar with drainage pathways or detoxification pathways. If you're not, I mean, it's just like the organs of elimination, being able to actually eliminate toxicity from your body. You need the drain open. So when you're detoxifying it, it can actually get out. It's a pretty simple concept. But when we're talking about organs of drainage or elimination, it's, your bowels have to be moving. Thankfully, I knew that, especially when I started nutrition school. I'm like, my practice clients, I'm like, oh, all these people are coming to me from their functional medicine doctors and they're on these crazy detox plans and they're not even going to the bathroom every single day. And I was at least aware of that. But anyway, for me, I guess I can say for me, for everyone, you have to make sure your liver is open and all stages of liver detoxification are functioning properly. Your gallbladder and bile health is moving. The bile is nice and thin and moving. Lymphatics is a very big one, and that's, to be completely transparent, an area that is very, very tricky for me. I really don't tolerate much lymphatic support at all right now. Just to kind of share a little bit of peek into my journey in my life at this moment, I am taking 1 drop of a homeopathic lymph support every 3 days and trying to work up to 1 drop every single day. I'm slowly kind of closing the gap and working to get my lymphatics, that kind of garbage system. It's kind of like a liquid garbage disposal system in your body. It's also very important for carrying different immune cells throughout your body. And then basically top down, you're draining. Your brain is a part of that. Your lymphatic system, that's kind of like the lymph of your brain. So I did not address drainage properly. And so finding something that actually really started to move the needle was really thoroughly addressing drainage. And it is a continual process. As I mentioned, my lymph still isn't moving very well. There can be things that really can get in the way of drainage, like parasites. I mean, parasites can be in any organ, like liver flukes. They love the liver. A lot of people have a lot more of that than they would realize. You can have parasites in your lymphatics. I believe that Bartonella and Strep and toxoplasmosis are big cloggers, so to speak, of the lymphatic system. So that was a big thing. Then addressing parasites, kind of connected to what I was just saying, was very instrumental for me. I did not think I had parasites before because I had done a stool test. And well, I knew that everybody had a little bit of parasites, but I didn't realize that, especially if you're very sick and very toxic, parasites, they thrive in a toxic environment. That's where they're going to want to set up shop and eat all of the bad bacteria and the mold and heavy metals. And then now, so I know I'm saying a lot, so if you need to jump in, let me know.
No, we're good. We're good.
The thing that's been really game changing for me, and it's been a very long process because, as I've said, I've got a lot of infections I'm working through, but I've been using homeopathy in what I would call like using homeopathy like immunotherapy, where we're using very, very low dose or very diluted nosodes. So nosodes are basically, for example, taking like I've got the Borrelia Lyme. We're taking the Lyme bacteria in a very, very dilute amount and at different potencies every couple days, then every week. And it's a whole process to train your immune system to be able to fight that bacteria or that infection well. So I've got a whole protocol for every single and all 8 infections that I believe are the primary infections that I've been working through since last like August or September. I've been slowly adding in support for 2 infections at a time. And it's been very amazing how powerful it's been. You'll see really interesting symptoms come up and then go away. And then, I mean, every single time I take one of the vials of the low dose immunotherapy, basically the homeopathic formula, I have very specific symptoms come up. I tell anybody who questions the efficacy of homeopathy, come see me take 1 drop of, I've got like 5 or 6 different formulas of lymphatic homeopathics that I cannot tolerate. Give me a whole dropper and my face will blow up like a balloon.
Wow.
Because it can't, I say the solution to pollution is dilution. It's like too much pollution. We got to dilute and hold on to water.
That's what the body does. Yep.
It does.
In terms of the formulas you're talking about, is it actually like low dose immunotherapy formulas, like as that like that specific therapy, or is it more nosode therapy?
It's nosode therapy.
Okay.
I use Desbio products.
Okay.
Yeah, I'm not completely familiar with the true the true LDI. Again, I was looking at your website and I'm like, oh, this seems very similar to what I do, but I don't know everything that makes it different. But it seems like the concept is very similar. It is a similar concept to like an allergy shot. Giving yourself a little bit of that, like, hey, that reminder to, hey, this is how you fight that antigen.
Right. With the nosode therapy, is it that you start with a low, like say like a not very dilute formula, like a 6C, 12C, or 12X, 6X, 30X, and then it gets stronger as you get more and more dilute, or do you start dilute and get closer and closer to a less dilute formula?
Yeah, so you actually start, which is interesting. I hear practitioners say this backwards a lot. And I'm taking a homeopathy course right now. I'm like, if this is why it's so important to, actually to understand mechanisms and what you're talking about. So you actually start with a more potent formula or more dilute with, depending on the kit, it's often like a 1000x vial. And then you move to the lower potencies, and then you move back up to the higher potencies
Oh,
again.
okay.
And then you stay at the high potency. It's like a 1M. I mean, you know what I'm talking
I know
about.
what you're
Other
talking about.
people,
Yep.
it's the more intense potency. You take that once a week, then you move to a 10M, the even like the strongest potency, and in this case for these different therapies. And it really, it's a 7-month process from start to finish to get through the entire protocol, which is why I've been at it for a while. And I'm really believing once I kind of can get through the end of all of it and hopefully really get my lymph moving part of it, I'm really believing that I'll see a lot of success, because in theory, it really should help you create immunity to those different pathogens.
Fantastic. Yeah, a lot of overlap with LDI. There's definitely some philosophical or like approach differences, but
Right.
a lot of overlap. Prior to learning LDI, which I think I've been doing that for maybe 8 years or something now, I did a lot of isopathy, which is
Right.
using nosodes or other things too. And like I saw some really crazy changes with that too with some patients. A lot of major flare-ups for some people, and then benefits, thankfully.
Right.
So we kept using it. But yeah, the LDI, lot of overlap there, just for reference.
Absolutely.
But I think it's I just have like patient after patient that I've seen over the years where like that approach has just blown out of the water, like the,
Right.
full blown antibiotic, regimens, or, hardcore herbal regimens, or we do a lot of IV therapies here, like, hitting people with high
Right.
doses of antimicrobials. And it's like, they've hit a plateau. And then we bring in some immunotherapy, and like, boom, like that just
Right.
really blows the case open in a good way. Sometimes in a flare up way initially, we have to be
Yes.
careful, but anyways, yeah, no, that's great. I'm glad that that's part of your protocol, and I hope it's really,
Right.
really impactful. It sounds like you're on the right track, which is awesome. Um, I have a couple of miscellaneous questions for you that I've got listed here, and I'd like to ask you those. I know we've only got a few minutes left, but just before we get off the therapies that helped topic, are there any other therapies of notable mention that you'd like to share with folks, or does that summarize it pretty well?
There's so many things that I've found along the way that I really love. I mean, random things that just not many people have heard about. I used to have very chronic panic attacks. That, I mean, it was like multiple times a week. It was the type of panic attack where you feel like you're dying. It takes a couple hours to go away. And I introduced cranial electrical stimulation. I use a device called BioTuner from SOTA. If anyone's interested, SOTA. I'm not affiliated anyway. I'm just a huge fan, because within a week of using that, my panic attacks completely disappeared. So there are certain things like that that really helped with symptom relief in this process for me. And I'm so grateful to find tools like that. And, I've got so many now in my tool belt. I just, whenever I have someone at my house for the first time, I just always think, I wonder what they think. I mean, there's so many random supplements everywhere, vibration plate, vitamin D lamp, and then, ring lights for social media. It's just like, I've got little homeopathic remedies everywhere. I'm like, it's probably, I don't know, look like a crazy voodoo kind of lady or something, but to some people. But that's one, if I just think of something that was a very powerful tool for me that really helped bring some relief to my life and help with some of that nervous system regulation, was that you clip it to your ears and it sends it just vibrates, I guess, sends microcurrents of electricity, and I don't really even know how it gets like to your vagus nerve or how that works. But yeah, that's the first thing I thought of just a really cool tool that I've really appreciated.
Is it a vagus nerve stimulator? Like, because I know there's a bunch of those on the market, but is that kind of its claim to fame?
Right.
It's largely working to stimulate the vagus nerve?
I don't believe that's the claim to fame. It
Okay.
does work similarly to like how people would use a TENS unit to
Mhm.
stimulate the vagus nerve, but I know there's they're very specifically designed harmonic frequencies to help balance neurotransmitters, but that's at least would be the claim from the original inventor
Mhm.
of the device. but man, I mean, I use it all the time, even just to kind of calm things down, to help me focus before a podcast. I should have done before this, but that's okay.
It's going well.
um,
So
that's good. Thank
what,
you.
I'll put the name of the device in the show notes. But so you said SOTA, like is that the name of it, SOTA, or is that a
Yes.
longer name? Okay.
So yeah, it stands for state of the art.
Oh, state of the art. Okay. I
Yeah.
shouldn't have any problem finding that. Okay, great.
Mhm.
Um, yeah, just to say, I think having a weird house is like a good litmus test for, do you want
It
these people
is.
in your life? So they come in and they never talk to you again. Okay, I guess you weren't really worth my time. So yeah,
Yeah, for
that's the protocol or process my wife and I use. We have a weird house too, so it works
right.
well. Um, all right. Let's see here. Okay, maybe I'll just try to get one rapid fire question in here. So you just mentioned about fat, about having issues with fat intolerance historically, and I'm just wondering, either from your own story or working with folks, if folks are really, really fat intolerant, as you said, I think even just like a small little bit of fat would set you off.
Right.
What are some of the things you're thinking about as causing that? And are there any just clinical pearls in terms of what can help to get that on track? I know
For
you are
sure.
affiliated with Cellcore. I know one of their claim to fames is the TUDCA or TUDCA, whatever.
Yeah,
So I'm wondering if that might be part of your answer, but I'd love to hear what you have to say.
for sure. Yes. So I do think that you asked, like, what do I first think of? I do think of gallbladder health. So, your liver produces bile, and the bile is then sent to the gallbladder, and the gallbladder stores the bile. And the bile is very important for breaking down fats, emulsifying fats, and also when your liver is processing like toxins, it's dumping that into the bile. So it's a very important pathway of elimination. It ends up getting into your stool before you eliminate. And there's certain things that can really clog the bile or make it stagnant. Mycotoxins from mold is a big thing that I think of. Then, I mean, estrogen dominance can also really create stagnation in the bile. And then, the question is, what's causing the estrogen dominance? I'm always thinking, what's the why behind the why. I that talking about mistakes I made again. I see so many people, and myself included, thought Epstein-Barr virus is the root cause, MTHFR is the root cause, or people say, "Oh, I found my root cause. It's PCOS or something." When that's those are symptoms or disease names, and not actually the thing that's contributing. So, certain things that I would do to help thin the bile. I do like TUDCA. It's a bile acid that is very, very helpful for thinning the bile and for all phases of liver detoxification. I do like, what is it, like beta TCP from biotics. It has like betaine from beets. If you can just eat beets. Beets is like an amazing food to help thin out the bile. Then so I'm thinking about like what's going to help get that bile moving. And then when you're having such crazy reactions to fat, like I was, I think, I mean, there's probably just a lot of toxicity that's not, because drainage is clogged, it's not moving through well. When it's starting to try to move through, it's causing this inflammatory reaction. So I would probably start thinking about bringing it in binders to help kind of clean up or mop up some of that debris or that toxicity. But you, of course, want to make sure that the bottom of that drainage funnel is open, that you're moving your bowels very, very frequently. So if I were to do things over again, I would have made sure bowels are moving quite a bit more than it was when I was so fat intolerant. Then I would probably start bringing in a little bit of that I don't know, the betaine from the beets, maybe some artichoke leaf extract, maybe some TUDCA, and just kind of slowly start getting that moving more. And as things are open, I'd start binding. And with other people I've worked with, it's amazing how much symptoms can improve just from getting that drainage, those drainage pathways opened better.
Super important.
For
And
sure.
something I probably should have mentioned when we started talking a bit about different interventions. Just as per usual with any other podcast episode, nothing we're talking about should be construed as medical advice. This is for
Sure.
informational purposes only. If you need any healthcare advice, medical advice, please talk to your healthcare provider for that advice. But thank you for sharing some of those pearls. I wish we had a bit more time, Mandy, because I'd like to pick your brain a bit more, but I know we're a little over our time. I know I have to go see another patient, and I'm sure you've got many things to do, especially if you have a little one running around. But thank you so much for taking the time to speak with me today. Thanks so much for sharing about your story and giving us some of those clinical pearls. Just before we part ways, do you mind just sharing where folks can interact with you either on social media or any offerings that you have for the folks out there?
Absolutely. Again, thank you so much for having me. And I'm really glad to get to connect with you. And I'm really excited to continue to learn from your work. I really appreciate from what I've seen, how you practice. I do think we have a lot of similarities in how we view things. So I've got my website, mandymeehan.com. There's not like a ton on there, but you've got the basics to kind of understand a little bit of what I do and, where the other places you can find me are. I do primarily post on Instagram for just sharing education and sharing my journey as well. Hopefully here in the next few months, I can continue sharing a lot of progress in my own protocol. And I do a form of group coaching too. If you're interested in working with me, usually I funnel people there first so people can kind of start learning how to open their drainage pathways, learn how to start expelling some parasites. And once you need a little more support, that's where I take my clients. I take my clients out of there because they're starting to learn the foundations from me, from my video collection, and then we can get in the weeds and we work together.
Mhm. And if they're interested in the group coaching, the best way to get in touch with you about that is through your website, or is there another place they would go? Okay.
Through my website, you can also contact me through there.
Okay, perfect. Great. Well, thank you so much again. I really appreciate your time. And thanks so much, everyone, for listening to another episode of the Overcoming Chronic Illness podcast. I hope it was educational and entertaining. And please stay tuned for the next one.